We are here with another Superior Health Wednesday. Jim LaJoy, Executive Director of Superior Health Foundation. Thank you for joining us.
Thank you.
Today we are talking about indigent care grants coming up for this spring, and the application process is upon us.
It is. Yeah. Yeah. So this will be another round. We do our indigent care grants yearly. The application period will be, February 1st through February 18th. And these are grants of up to $5,000 to nonprofit organizations all across the Upper Peninsula that really have a policy in place to address those clientele that have indigent care needs. This is a fund that we've created a few years back. It's been very successful. We've awarded 7 grants in our past, $37,500, and for this year, we will have a little bit more than $41,000 to award. So potentially, we could help up to 8 different organizations with this funding with Indigent Care Fund.
And we want to make sure that the right kind of groups, organizations are applying for these grants so that they're not thinking they're applying for one thing and they might not be a good fit. How would I know, or how would an organization know that they fit into that those indigent care needs? What does that look like for them?
Sure. Good question. Well, first off, you need to be a 501c3 nonprofit in order to apply. I think the second criteria is you need to have at least some semblance of a policy in place about how you address those who fall into the indigent category in terms of being unable to pay their bills and provide them those resources that they may need for that. So we have funded a number of different projects over the years. We worked with St. Vincent de Paul to provide funding to help people with out-of-pocket expenses for their medications. We provided funding to the Marquette County Health Department to help with a SMILE project to help individuals with out-of-pocket expenses for dental work. And things of that nature that have really provided that, that extra funding and that extra cushion to be in a position to help those people who fall into that category. The one thing that we don't do is we don't provide funding to individuals. It needs to come right from the nonprofit organization. And then once they identify who those individuals are and who can benefit from that, then we empower them to make those decisions and divvy up that money the best way that they see fit.
And that just keeps things in a good order of you're just being the vehicle for these things and leaving it up to the organizations who that's their specialty of connecting people with those funds when they need them.
Yeah, absolutely. And, and it comes back to kind of a familiar theme that we've been talking about. It's conversations, it's discussions, and really, trying to find out what are some of programs that they have that the indigent population could benefit from. And it's those types of conversations. We talked about St. Vincent de Paul and how we ended up funding that. That was a couple of phone calls, a couple of emails, and really crafting something that could benefit them and benefit a larger population, because, this is sometimes a group that sometimes isn't on the radar, and we want them to be on the radar. Particularly now, Ben, I mean, with this pandemic and all of the financial needs that people have, it's our feeling that this fund is probably at the apex of how important it is. So we think we're going to get some really quality applications with this, and we're looking forward to sitting down and reviewing those proposals.
And I mean, that's being able to help 8 different organizations. I mean, you're helping the entire Upper Peninsula, so that goes out pretty quickly. You already touched on it. There's a great need for that care, for providing that service, and being able to take away some of that stress from people, and that gets in the way of them getting the care that they need. So that's huge.
Yeah, absolutely. And we hear stories, and we, whether it's on the news, on the radio, you hear stories of folks who have to make a decision about whether they're going to get their prescription medication or whether they're going to get food to eat. And that's heartbreaking. Those types of stories are heartbreaking. And we know that we can't help everyone. That's just not the way it is. But those people that we can help and provide that reassurance and give them some of those extra tools to help them to release some of that stress and anxiety. I mean, that's incredibly important. And what we have found is that a number of organizations across the Upper Peninsula have some semblance of an indigent care policy in place. And this funding is just to help supplement that and help provide that cushion to help more and more people.
And we want to help get people connected with you so that they can do this. So it's not just if they would go online, they fill out the application for the process, but if they have questions, they can come to you, they can have a consultation and figure out if it's a good fit, and you'll walk them through that process.
Yeah, absolutely. The information will be up on our website. It's a pretty easy online application that shouldn't take too long. But to your point, yes, we're here at the Superior Health Foundation. People can call us. Our direct number is 906-225-6914. Call if you have questions about eligibility, about whether you qualify or not, and we'll be very open and transparent about it. And the interesting thing is that there may be situations where this may not fit into the indigent care. So our role is to kind of direct them to what else may be a fit. And we take a lot of pride and we take great solace in knowing that if it doesn't fit for our organization, we can provide resources to them to apply somewhere else, because it's all about helping people. So we encourage people to reach out and ask those questions.
I did not realize, and as we're having these conversations, just how much you do to connect people, whether it's directly or indirectly, that you provide a lot more services than people might even be aware of. So I think this is hopefully a good way to connect people with that. And if people are watching this or reading and they're hearing about this and they want to help, they want to support your mission and ultimately these organizations, what's the best way to do that?
Well, the best way to do that, and there's a couple of different options. Either you can apply, but this is a fund that we're continuously raising money for in the foundation. I know I personally contributed to this because I personally know people who are down and out and can benefit from this. And so on our website, there's a give option right on our homepage at superiorhealthfoundation.org. And then if you go to the grant tab, you can learn about the Indigent Care Fund. You can not only apply there, but you can learn about what it is, what are the criteria, what we're looking for. And one thing that is that I struggle with that is very frustrating is the worst thing that can happen to us is me running into someone, whether it's on the street or with a phone call, and them not knowing about the fund and they missed the deadline. That breaks my heart. That really does. Because then they have to wait an entire year again to apply. So it's worth that phone call. It's worth finding out and seeing if you're eligible, because we want to be able to be in a position to help. And if we can't help with this, we can at least redirect to an area that you can potentially get some funding.
Good. Is there anything that we haven't talked about today that you want to make sure to cover as far as these specific grants?
No, I don't think so. We just encourage people to take a look at it. Again, we have more than $41,000 in funding, which is the most that we've had to award. And with $5,000 being the max, we could help out 8 organizations across the Upper Peninsula. And during this pandemic and during this crisis, we have to believe that there are needs out there, and we encourage people to go online to superiorhealthfoundation.org and apply for funding.
Well, Jim LaJoy with Superior Health Foundation, thank you as always for doing this and helping people get better connected to resources in their community. Thank you.
Thank you so much.